Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening. Today is our first day in the Emirates Society of Ophthalmology Conference at Yas Hilton in our beloved capital, Abu Dhabi. I'm great today to start my evening with Dr. Abdulaziz Rajhi, who is the CEO of King Khalid Eye Specialist Hospital. Dr. Abdulaziz, he is a well-known expert in the region, and on international level, he is an anterior segment consultant. Dr. Abdulaziz, he and with his team, they started our conference with the opening session from King Khalid Eye Specialist session, and we are really delighted to have him today as a guest, and I'm really honored to interview him, and looking forward for an inspiration from his side as an ophthalmologist, and an interactive interview for the coming minutes. So enjoy it, and Dr. Abdulaziz, welcome.
Thank you very much. It's a pleasure to be here, and thank you for the invitation for King Khalid Eye Specialist Hospital to be part of this meeting.
Dr. Abdulaziz, today for the session, it was really it was the shed of our conference, because it's we were honored really that you accepted the invitation, and by yourself you have introduced your esteemed colleagues. I would like to know what are the highlights for this 1 hour session, which has been beautifully passed, and I would like to convey the highlights of the session to our audience.
Thank you very much. As I said, it's been a pleasure to be part of this meeting. Our session covered 4 topics: glaucoma, retina, anterior segment, and retinoblastoma. In anterior segment and in glaucoma, our speakers focused on the latest technology and advanced methodology of treating glaucoma and the different corneal transplant procedures that we do at King Khalid Eye Specialist Hospital. And then the retina session talked about our experience in using Luxturna, which is the first actual treatment, genetic treatment for retinitis pigmentosa that is caused by a deficiency in RPE65 specifically. And so far we have treated 5 patients, so we presented our experience in treating these patients. And the 4th talk was on retinoblastoma. King Khalid has been treating retinoblastoma for the past 40 years. So we have a very wide experience with the different cases at the different level of complications and presentations. And we presented what we have learned over the past 40 years and how we manage the different cases that we see within the hospital.
Yeah, this is really promising, the retinitis pigmentosa, and it's really achievement. And always with we look up to King Khalid Eye Specialist Hospital, and we are really proud to have such an institute in the Gulf.
Thank you very much.
Well, with your vast experience as CEO, it's almost like 7 years, mashallah, and being a chair or a leader in the Eastern and Mediterranean organization in prevention of blindness. We know that, alhamdulillah, in the Gulf, with the government support, by all means, to elevate the quality of the health services, including ophthalmology. And as you said, Luxturna is one of the great initiatives for the retinitis pigmentosa patients, which at least it's accessible in other countries. However, we are better than 10 years back.
Oh, absolutely.
As your experience and well expert with the ophthalmology field, in the coming 10 years, how do you find ophthalmology, or how do you vision ophthalmology in the Gulf?
As you rightly said, I think we've come quite far from what we were several years ago, and we have a lot of challenges that we are going to face ahead. One of the main, I think, that we will have to deal with is the rising incidence of diabetes within our population. So we are expecting more cases of diabetic retinopathy and diabetes complications on the retina specifically. And this is going to be a big challenge that we have to deal with from now. And I think we need to shift our focus in the GCC, which we are already doing now in most countries, to primary care and prevention and health education, rather than focusing only on the treatment by itself. Another, I think, problem that we're going to face quite soon is the rising incidence of myopia in our young generation. And this is seen worldwide. It's not only in our GCC country. As you know, in Asia, there is a huge percentage of children nowadays that have myopia. In some countries, it's beyond 70 and 80%. And now we're seeing in our region and in our countries that this percentage is also increasing within our children, probably because of the confined space that we live in and the focus on social media and smartphones and smart gadgets. So all the time it's close distance for them, and therefore many of them now do not develop the normal vision that we would expect them and like them to do. So these two, I think, need to be addressed. We're lucky that over the past 10 years we have moved away from all the infectious causes of visual impairment in the region. So trachoma now has been eradicated in all of our countries, which is a great achievement. And now I think that, and we also now seeing with the increasing age and the shift in the quality of life that we have in the region, an increased incidence of age-related macular degeneration, which was previously quite rare in our region. So these are, I think, some of the problems and some of the challenges that we'll be facing soon.
Yeah. And another also important thing that to highlight that Dr. Abdulaziz, he is also the King Khalid Eye Specialist Hospital. It's well known for residency program.
Yes.
And along the year, if you can see, if you just for the coming generation, for our younger ophthalmologists, I would like to end this, to conclude this interview, or this beautifully well spoken from your side. Dr. Abdulaziz, I would like to, I want to know what a couple of advices to our younger ophthalmologists, just now paving the road to be like what we are now. So can you give our ophthalmologists, even our colleagues and to ourselves, advices?
Thank you very much. This is a very dear and close topic to my heart. My advice to our young colleagues, and to me this is very important, focus on why you joined medicine. You did not join medicine to make money. You did not join medicine to be famous on social media. I think, and I assume that most of us have joined medicine to try to heal people and help people who need our services. So please don't lose track and don't lose focus on your main aim for the reason you joined medicine. Wealth, everyone wants extra money, and no one is telling you don't make it. You will make it. As long as you focus on your craft and you are good at what you do, money will come and fame will come. A good doctor, as we all know, is usually known by word of mouth, especially in our region, and especially if people who are your colleagues know you well and recommend you to others. Social media does help you, social media does give you exposure, but it's not always the only way you can present yourself to people. So among all the confusion and all the other things that distract you, please don't lose focus on why you became an ophthalmologist. Again, it's not fame, it's not money, it's to treat people. And I wish you all the best.
And to be true to ourselves.
Absolutely.
Yes.
Always.
Dr. Abdulaziz,
thank you very much.
Thank you so much for your time, and wishing you a pleasant stay, and looking forward to meeting you in future.
Thank you for the invitation and the kind hospitality, which is the usual that we see from our sisters and brothers in United Arab Emirates. And it's always a pleasure to be here.
Thank you, Doctor.
Thank you.
Good night.